The key to that proposal, though, is that just because everyone gets access to health care doesn't mean they're going to know what to do with it. We as pharmacists are not a problem in the healthcare system, but we can be its solution. And how can that happen? We have to work as a team. Pharmacists, as well as other professionals out there, have to get together and help with patients on a group effort. Patients have to buy in as well. Healthcare, they have to realize, is not a spectator sport. It is something that they have to participate in actively. In order to make that happen, we have to learn when we're dealing with patients to look, listen, and learn from them, and get an understanding of what the patient's all about and what their problems are, and then that way we convey things back to them so that they understand what we're talking about. I think the biggest way to look at this whole issue is that one needs to look at the pilot projects that are out there, dealing with consumers and employers to help save money in terms of health care. A key to that would be what APHA is doing right now, called the 10 Cities Challenge. And that is in 10 different cities, in 10 different states within the U.S. And the upside of all that is that by working with employers and patients who have diabetes, they've given them an understanding of what their disease state's all about and what they need to do to make things better. The net result of all this is that these employers saved somewhere in the range of about $1,500 a year per patient. And that was just a small group. And anybody who's a mathematician out there can just take those numbers and multiply them out times the population that there is, and you're going to see a whole lot of money. My words are basically a prelude to the making of a complete healthcare system. The citizens and our healthcare professionals of this great nation need to learn that we do have to work as a team. I think the big thing is that the U.S. is recognized as one of the most highest spending countries in the world in terms of healthcare. By utilizing programs like the 10 City Challenge, we can get away from being the highest spender to one that is the least spender, but one that is the most productive. And